It's one thing to ensure that we have the spaces in long-term care, but it's quite another to ensure that we have the staffing. And so my question to you is, what will you do? So I'll start with you, Camille, and then I'll go to you, Minister Dix, and then finally to you, Karen. What will you do to ensure that government funding is such that care homes can support 4 hours of care per day for each resident?
So this is a great question, and it's important to acknowledge, as Minister Dix just shared recently, that we are making progress. We really are, right? I think he suggested that we are now up to 3.5 hours across the province, and that's great. That is amazing. However, what I agree with is that we do need to do more. This level of care is not adequate, and if 4 hours is where we need to get to, then we need to work to do that. We can increase our numbers by making sure, again, coming around to this common theme, right? Making sure that the direct care is spent on direct care. So the problem still remains that the for-profit corporations are not providing what we are paying them to provide for direct care. And this must be resolved immediately. So we already have this struggle to reach for, but then we're facing this additional struggle where we aren't even achieving what we are paying for. So we have a very firm position that before we consider the need to increase funding, we first need to really ensure that existing funding is being used appropriately. As I mentioned before, I've been at the doors. I have a lot of senior constituents in my riding, and a common concern that I'm hearing from constituents is anxiety over rising taxes, and like how that revolves around the affordability issues. And their concerns that the only way they see forward in improving the healthcare system is by them paying more. And so we propose that we need to refocus. Despite the spending, despite the excessive spending, let's say, that we have done over the last few years on healthcare, the outcomes have not necessarily improved. And we really need to keep coming back to that because it is important. Because the idea is that if we continue down this path, if we double down on the status quo right now, and if we even increase funding alone, but we don't address the issues that exist within the system, we will not see better results. So we need a new approach that links spending to measurable outcomes and addresses the shortcomings with absolute urgency. Because this province simply can't afford to keep wasting money or lining the pockets of corporations. We are harming the people when we proceed in that fashion. So it is our belief that if we achieve this, then hopefully we can actually see seniors with Alzheimer's finally getting the quality of life that they do truly deserve.
Thanks for your comments there, Camille. Minister Dix, I'll go to you next in terms of the question around funding for that provision of 4 hours of direct resident care, and any additional comments that you'd like to provide as well, of course.
Well, I would say, first of all, we have made this a priority. It was one of the first things we did, and thankfully we did it in advance of the pandemic, which is to increase direct care hours for every long-term care home in BC. That increase, the numbers sound, when you say 3.08 to 3.58, the numbers sound a little bit hard to understand, but that's a half an hour of direct care per resident per day than it was before I became Minister of Health, which is significant. How do you get there? You get there by training people and working with people. One of the reasons that British Columbia had the best response to COVID-19 is that we worked with everyone, with health authorities, of course, and health authority owned and operated facilities, but also with private facilities, increasing screening and supports for people when they critically need it, when costs went up, supporting those costs through the COVID-19 pandemic. All of the actions that we've taken, which I won't lay out here, we're not debating what happened during COVID-19, but it does show what can happen when you work together. We do need, when we do long-term care contracts, to ensure a new funding model that addresses the differences in long-term care homes, and we are putting that in place in cooperation with long-term care homes. Some of the measurements have already been put in place. And finally, you've got to have the people, both in long-term care and in home care and home support. And I didn't hear anything about this in Camille's response, but I would say that tangibly, we promised in 2020 we bring in a program, an HCAP program, which would deliver more care. And it has delivered. And we didn't do it because we opposed people or we attacked people. We did it because we worked with everyone, all of the care providers, to see that that program was successful. And what happened? 8,500 people through that program, 7,100 of those for long-term care, the remainder for home care and home support. And if you talk about the critical importance of that, about allowing people to work in the sector and then ladder up in their work so that they can get more responsibilities and provide even more care, I think those are significant things. You need more people to get there. You need a commitment of government. And yes, that requires money. It absolutely requires money. Yes, when you stop paying poverty wages, it costs more money, I would say. That's not a question of efficiency, that's a question of justice. And how do you recruit people to this sector if you were to continue what had happened before under Bill 29, which was paying poverty wages? So we are fundamentally committed to improving long-term care. From a personal point of view, I am, because of course, your family members have been in long-term care, especially during the pandemic. We know what that meant. And as well, ensuring real plans, tangible plans that we can continue to expand to meet those goals in the future. You need more people, you need more long-term care beds. We're delivering both, and that's what's at stake in the election.
Thank you for your comments there, Minister Dix. Corinne, over to you.
I'll try. I'll make mine quick because I think it's more important what the platforms are for the policies. But I do think that we need to invest more in post-secondary education for healthcare workers. I'm not sure with HCAP, there are a number of people that come through that program that actually aren't able to be doing and providing the kind of care. So when we hear the numbers of the people coming through, it doesn't necessarily equate to an increase in staffing that we can have providing care and long-term care and home support workers. I'm going to just follow up something Camille had said, which I think is really important, is that what we haven't seen from this government is the connection to dollars spent to actual outcomes. And so I've heard Minister Dix and I've heard the Premier frequently say we've spent more money than anybody else has ever spent in healthcare before. But we can't actually take a look at, well, what are the outcomes? Are the outcomes better? Are they the same? So where is the quality? And one thing I'll also say to Camille, maybe a bit of a different look at this, is that when we talk about the service delivery hours, and if we're not getting the proper service delivery hours out of for-profit, for example, I think we have a problem as government, and it goes back to not tracking data, is that there has to be better oversight then in those service providers, whether they're nonprofit service providers or they're for-profit service providers. And we also have to be looking at qualitative care. So it's not just direct service hours, but are those direct service hours, are they qualitative? Are they doing what they should be doing? So investment in education, that's going to really help to bring more people in. Certainly an investment in wages and making sure that people are being paid appropriately, and just supporting really getting some data so we can make good strategic decisions in terms of what's working and what's not working.
Thank you, Corinne. Appreciate your comments. I'm gonna